I want you to stop for just a moment and listen. This video is critical if you're a woman or if you're a man who has a woman in his life who he cares about. So that should include pretty much everyone. Let's jump right into it. What if you could easily decrease your risk of heart disease, colon cancer, diabetes, Alzheimer's, risk of fracture, and live 10 years longer, healthfully? What if that was a possibility? It actually is, and we are talking about a pill. And if you know me at all, I'm never talking about just a pill. I'm talking about diet and lifestyle. So if I told you that what I'm talking about is hormone replacement therapy, what instantly comes into your mind? Maybe it's, wait a second, there's a danger there, isn't there? Isn't there an increased risk of breast cancer? Isn't there an increased risk of heart attack and stroke? You've heard that. That is true, but it's completely false. So that's what I want to jump into. So here's the story. Back in 2002, there was a big study, and when I say big, I mean $1 billion big, and it was called the Women's Health Initiative. Half of it at least was really dedicated to hormone replacement therapy. And the study was stopped prematurely, so it was supposed to go on for a certain duration. It was stopped prematurely, and there was a big press conference. And this press conference occurred before the results of the study were even released. What came out is maybe what you thought of when I said hormone replacement therapy. And it was, we had to stop the study prematurely because there's an increased risk of breast cancer, there's an increased risk of stroke and heart disease. Turns out that was completely false. How does this happen? That's where the story becomes a bit of a nightmare. It turned out the results were misread and misinterpreted. So the risk profile of causing breast cancer, causing stroke, and heart disease was incorrect. In fact, hormone replacement therapy protects a woman's heart to the tune of 50% less heart disease and decrease in life expectancy. That study, and no study since, has shown any increased risk of breast cancer mortality. The result of this misinterpretation has prevented 50 million American women from getting the help they need from hormone replacement therapy, to the tune of increasing heart disease and death from it, diabetes, fracture risk, Alzheimer's, and more. Doctors over this period of 23 years have received no education in school about menopause and hormone replacement therapy other than continuing this false narrative that it's somehow dangerous. So I hope you're listening fully to this video, but if you get nothing else out of it, I want you to know that hormone replacement therapy is not only safe when, of course, prescribed correctly, but it saves lives. It saves a woman's brain, her bones, her heart, her colon, etc. Here's a fact for you. There is no organ in the human body, not just female, male and female alike. There is not one of your organs that does not have receptor sites, in other words, like docking stations, binding sites for estrogen. No organ that doesn't want estrogen. So what happens to women in menopause, starting in perimenopause and menopause, is we just fall off a cliff because we're not producing estrogen. And all of these organs are at risk because of it. Increasing Alzheimer's by 35%, increasing your risk of death of heart disease by 50%. When it comes to fractures, a woman who sustains a hip fracture or a femur fracture, so the thigh bone or the hip bone, in the first year after that fracture occurs, 1/3 of women die. That's how significant it is. 50% of them, a full half, never return to the life they had before they fell. In other words, they're somewhat disabled. They require care because of a hip fracture. When up to 60% of these fractures are eliminated by being on estrogen, by being on hormone replacement therapy. You can take estrogen alone as a woman if you don't have a uterus. You take estrogen and progesterone, and sometimes testosterone as well, if you do have a uterus. You need the progesterone, in other words, to protect the uterus. If a woman's had a hysterectomy, she does not need progesterone. There is some discussion about whether you're eligible to be on HRT if it's been more than 10 years past menopause. That is something you can discuss with your doctor. The biggest risk that's looked at is perhaps blood clots. So this is particularly evident in women who have history of cardiovascular disease, obesity, high blood pressure. They're in a cardiovascular risk profile category. So this is not every woman. So there are plenty of doctors that look at the studies and say, honestly, women past 10 years, the difference between the study group and the placebo group was no different. So many doctors argue there's no increased risk by being on HRT. So again, it's a discussion you have to have with your doctor. Speaking of your doctor, the likelihood that even your gynecologist is not up to date on this information, it's possible. For sure, your primary care provider, even endocrinologists are not up to date on this information. I've just done a personal study over the last couple of months since this data came out, and I'll go back to the FDA and what they've done recently, which is wonderful. But there's not enough discussion about this, which is why I wanted to do a video on this and really encourage you to spread this far and wide, because women are suffering needlessly with depression, risk of bone fracture, heart disease, colon cancer, diabetes. All of these risks really diminish dramatically when you have estrogen on board. Now, is that the only thing you should do? No, we can get into that discussion in another video, but it's very, very critical when you're in the perimenopause arena to look at getting estrogen into your body so you can protect yourself. Now, this next section is for everyone, regardless of your age, which is exciting. And that is something called vaginal estrogen. So vaginal estrogen stays in the vaginal area. It does not go systemic, meaning it does not travel throughout the body. So even women who have had a prior cancer history, this is extremely safe. Again, this is something that not all doctors are up to speed on. So now you know, and it's fine to share this information. I will have in the description of this video links to studies that you can show your doctor, because this one is important. And why? With no estrogen in the vaginal genitourinary area, so this includes the risk of getting urinary tract infections, vaginal dryness, etc. So the stat is this, that up to 80 to 90% of women in nursing homes have urinary tract infections and or bacteria in their urine, which can lead to urinary tract infections. The problem with this is that the symptoms are very different in an older population as compared to a younger woman who gets a urinary tract infection. In the younger population, women have, it's very quick to know they have a problem. It burns when you urinate. You're urinating frequently. You feel like you have to urinate and 2 drops comes out. It's a very obvious symptomatic profile when you're younger. When you're older, that profile changes. You don't feel that same irritation as you urinate. Instead, you have confusion, fatigue, agitation, such that a urinary tract infection can actually be misdiagnosed as signs of dementia, because that's how a woman changes. She changes mentally with a urinary tract infection. These urinary tract infections can not only lead to medication a woman doesn't need, but it can lead to sepsis, which is an infection throughout your body, and you can die from sepsis. It was estimated that Medicare could be saved from anywhere from $6 billion to $22 billion a year if women would get on vaginal estrogen, thus preventing these urinary tract infections, visits to doctors, need for medication, antibiotics, etc. As we know, antibiotics change our microbiome, and then there's a whole host of downstream effects that go with that. So vaginal estrogen is safe for everyone, regardless of your age, regardless of how many decades or years it's been since you've undergone menopause. It is safe for you, and it is very, very protective. Please share this video far and wide, or any similar video that you find, and that's fine. But this information needs to be shared far and wide because too many women are being compromised in their life expectancy because of this fear of hormone replacement therapy that they have, that their doctor has, and it is impacting us, we women, very, very strongly, and it doesn't need to. So if you hadn't heard, the Food and Drug Administration came out just about a month ago now, and they are removing the incorrect black box warning that has been on hormone replacement therapy for the last 23 years. And this is a black box warning that states this product will put you at risk for heart disease, stroke, breast cancer, on and on and on and on. So it's amazing any woman would take it reading that, but some do, very few do. So even if their doctor is savvy and understands the benefits, the doctor still has to prescribe something that when a woman gets it home has this black box warning scaring, them terribly. And then of course, how do they feel about their doctor? It's like, oh, that's great. My doctor just prescribed me this HRT and look what it says. And he or she didn't tell me that. Well, that black box warning is being removed because it was patently false. All of those warnings were not only incorrect, but the exact opposite was true. So again, I encourage you to share this far and wide. Tell all your girlfriends, tell your mother, your aunt, your daughters, so we women can live life stronger and healthier and add a healthy decade to our lives based on research. So I hope this was helpful. If it was, give it a thumbs up, subscribe to the channel. Please write me a comment. There's much more I would be happy to talk about on this topic. So if you're interested, let me know and I will do so. We'll talk soon.